We are actually launching this year violence detection from AI that's looking at both audio and words that would indicate violence. We offer capabilities for care teams to call what's called a behavioral response team or security team. As you create an ambient capability in the room, it's looking for things and you can interact hands-free.
Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change.
Well, hello, and welcome back to another episode of Boombostic Health. I have the pleasure today of having Adam McMullin on. Adam's the CEO of AvaSure, and he's out in Raleigh, North Carolina today, I understand. Pleasure having you on the show, Adam.
Hey, Bradley, looking forward to the conversation.
So we were initially going to meet up at Vive, and there was just so much going on for both of our schedules. We were able to get this booked as a follow-up. How did the Vive conference go for you, by the way? Was it a worthwhile trip? A lot of times people ask me, should I go to Vive or not?
You know, we find a lot of value in Vive in getting to a fairly senior audience. Chime has part of their meeting there. That's the College of Information Management Executives. So a lot of the CIOs, and they're one of the key constituents for what we're doing, are there. I was able to connect with one of our customers, the CEO of the health system, and talk about some of the really neat innovations we're bringing into the care environment around, in this case, it was computer vision vitals, and just spend some face time. So it was super high value in those one-on-one discussions, a little smaller. So that's where we see a lot of value.
That's cool. Yeah, we had a consistent experience with that where it was a worthwhile visit for sure. So getting into the meat of this, we've got AvaSure, which is really benefiting from this huge tailwind related to virtual care. And things have evolved and matured so much in this space. And you previously have been in other tech industries other than healthcare as well, right? Can you piece together your story a bit, and then we'll dive into the real matter of how AvaSure is bringing meaningful innovation into healthcare?
You know, I started my career way back when, trained as an engineer and went into technology consulting with IBM, and you had this opportunity to work around the US and live and work in Europe and in Asia. And really got to see how you could apply technology at scale to transform areas, whether those were supply chains or manufacturing. I was part of a team where we helped commercialize the first multi-core processors, which then had an impact on things like medical imaging. But I was never in healthcare. And the work I was doing, if you hired IBM, it tended to be big problems. And so it was intellectually interesting. And you work with really smart, high integrity people. But ultimately, I wanted to lead a business. And a colleague of mine that I went to business school with, Mike Gallup, said, hey, there's this company, Hillrom, and they've got a technology business. And would you consider joining that? And it sounded exciting because it was a division of a company that had its own headquarters and was in an interesting space. And before I got into healthcare, really my only experience or connection with it is a nurse that agreed to marry me. And I thought it was fun because we'd get into healthcare and we served a lot of nurses, which, by the way, are out on the front lines, delivering real time in front of patients and their family members, and asked to do so much. And I got into healthcare, and I personally found a sixth gear because you could connect the dots to what you were doing to help care teams deliver, to their impact on patients, returning family members back to their families, community members back to their community. And you'd bring in and have nurses come speak at town halls, and you just get these passion bumps for the difference you could make. And I found, not only did I sort of find a sixth gear getting into healthcare, it made a real difference on the types of teams you could attract. And folks were really there for a mission. And as I've now been in healthcare for 2 decades, which is mind-boggling to me, that's been consistent, right? In each company, how do you sort of anchor on a mission, a reason for existence, and then use that to propel yourself, your team members, align your team members as you're moving forward, to do something that makes a difference, that's a noble mission.
So you married your way into healthcare, and
Yes,
you
I
must
was
have
very
married a
lucky.
saint because it's challenging to work in healthcare. And the fact that what you heard caused you to say, I want to be in that as well. That's pretty cool. I love that story. And just as a side note, my significant other is a healthcare regulatory attorney. And so very much, live in this world where the dinner conversations are oftentimes fairly deep and nuanced related to all the opportunities to make healthcare better. But I think it makes for a pretty cool dynamic when you've got the whole team really focused on making healthcare better. So you got recruited over then at some point into this CEO role at AvaSure. Was that through a connection you had, or how'd you get into this seat? And then how much can you tell us about what AvaSure is doing?
Sure. The last business I had the privilege to lead was delivered sort of an electronic medical record and patient engagement and billing to retail pharmacy in a lot of communities. That is the only licensed professional. So there's a play, as there is in many healthcare professionals, to expand licensure so that you can have more care delivered. And that business it scaled up to a point that we needed to find an even larger partner, and Omnicell acquired it. And it was great for the customers. It was great for the team. But ultimately, I wanted to continue to do this. And I looked at a lot of things before joining AvaSure and got so excited about AvaSure because of a few things. The really measurable ROI and outcomes that AvaSure helped customers deliver was at the heart, right? I know you're on the investment side, Bradley, and you look at a lot of different investments, and sometimes you're scratching your head to say, why does someone pay $1 for that? Why would
Right.
they make that trade? And
Yeah,
at its heart,
a lot of times you find people with a solution in search of a problem in healthcare, because it seems like, hey, this makes
absolutely.
sense. And the incentives in healthcare are so different and oftentimes not even logical that you really do have to find a bit of magic to see something in a business that you want to step in and be CEO of. Because obviously it takes a lot of cycles to make this happen.
Yeah, and if you can't answer that basic question as to why, what's the ROI and is it really hard dollar? It's a tough business to go grow and scale, right? And you want to work on things that can be successful. So number one, the ROI, and we can touch on that later, was really, really strong. Two, you could see the evolution, as you mentioned earlier, around virtual care. Whatever we thought we were going to do virtually before the pandemic, that aperture significantly opened in terms of making the right resources and available at the point of care and improving access. So you could see a market that was growing. And then the third thing I always look for in a company is, can you get comfortable that that company is durable and can win? Does it have the resources? Does it have the financial wherewithal? Does it have the team members? And, in a market where we have had a lot of sort of startup activity, AvaSure generates cash. It's been around for a decade. And that gave us an ability to make longer term decisions and invest in our own growth. So for those three reasons, I got excited about the business on paper, and then I met the team, right? Because at the end of the day, you've got to work with people that share the same type of vision for success, that are growth oriented, that are highly ethical, that are great partners. And that was within the business, but also at the board level. You want to, unless you have alignment between your management team and the board, it's just really hard to move quickly. But when you've got the right sort of capital and you've got the right business and the right alignment with the board, you can run laps around a lot of the market. So that's how I got here. It was 4 years ago, and we've been getting after it ever since, and it's been very rewarding.
So what's so compelling about this, and who are you selling it to? Like, what's the story?
Yeah, so at AvaSure, what we really deliver is the most widely adopted AI-enabled virtual care and smart room platform. And AvaSure really pioneered a space called virtual safety. And the thing I loved about virtual safety is that demonstrable patient outcome and financial ROI. So 10 to 20% of patients in hospitals need observation. Traditionally, you put someone in the room that takes resources away from care teams, they're hard to staff, and AvaSure said we could do this virtually. And what's amazing is that that's a core foundational pillar to bringing virtual care into health systems, because you can day one take something that costs between $20 and $35 an hour and do it for free, and you will do it better. You will reduce falls by 50%. We've got myriad business cases. Trinity saved over $20 million annually. We just had a customer, HMH, that over the last 7 months, 1.6 million is a combination of virtual care and nursing. So really good financial outcomes. And then it sets you up. You've created a virtual care center. You've put infrastructure in to then do other things. And that's what we are really, really good at. So we deliver safety, we deliver consults, and then we use AI to really create a cocoon of safety and efficiency within the room. So
interesting. Well, I can tell you, I see a lot of websites just like you do, and I really like the way that you have your homepage set up, where it immediately gives you this visual of this individual who's in what looks like a home setting, kind of like a condo or something. And they've got this video system, and you can see on the screen, it looks like it's probably a nurse or a physician that she's engaging with. And they're going through different risk factors that the patient has. Is AvaSure generally being applied in any specific specialty? Is it like for primary care for people who have really difficult health issues where they're not maybe as mobile, it's hard for them to get into the clinic, or is it broader than that? Talk a little bit about, like,
for sure. So our customers at our heart are health systems, right? And we try to help them with a couple of problems, right? We want to help them improve safety, period. And I can comment on the specific things we do with behavioral health management and falls and other violent, care team violence. There's a whole set of things we do to improve safety. The next thing we want to...
Did you say care team violence?
Oh my gosh, we've seen, when we're patients under monitoring, we've seen situations where family members have brought weapons into a hospital. It just breaks your heart, and we can...
Oh, so it's the violence against the care team.
Yes, actually, the violence against care teams is shot up significantly since the pandemic, and you're oftentimes in there alone with patients and their family members, and unfortunately, there's an increasing incidence of bad things happening. And
wow, sorry,
surveilling for that.
I had not heard of that as a particular area of safety. I actually thought I might have misheard you. So you're saying with this, you cut that out because you've got the individual.
You've got eyes in the room. And then we are actually launching this year violence detection from AI that's looking at both audio and words that would indicate violence. We offer capabilities for care teams to call what's called a behavioral response team or security team. As you create an ambient capability in the room, it's looking for things, and you can interact hands-free should you need additional support.
Okay.
So
that's fast.
Jumping back to the problems. Oh, go ahead.
Well, I was going to say, at some point, I'd love to hear about how this fits from a payer perspective. Is there a value-based care play here? Is it really more oriented today toward more fee-for-service structures? And because obviously, if there's no margin and no top line impact, it's tougher to justify. It sounds like you guys have a really good financial equation. So keep going down your track.
The problems we solve are safety, workforce productivity, care access, and tech consolidation in the room. So let me jump right to where you were going and say, how would you pay for that, right? Why would you pay for that? And the ROI that's delivered is there's a significant workforce productivity around safety, where you can take, as I mentioned, something that costs $20 to $35 down to $3. And, that's going to save you $1 million for every 100 beds you have right then and there, hard dollar savings. And you can control that within the four walls of your organization. And that funding is often enough to fund the entire virtual care program, where you're putting devices in the room, high quality devices with night vision and precision audio, connected in through the TV, that then allows you to do other things. So as you think about care team access, how do you bring the right resource to the point of care? So if you have a patient that comes in and they need cardiology or nephrology, and you're in a regional hospital, you can make sure that they can come in virtually and be able to serve that patient, which is really important from the top line, Bradley, as you mentioned, so that you can retain that patient, serve that patient, and the health system benefits from the marginal contribution of $10,000 to $15,000 a patient that they might not have otherwise been able to serve. And then we also are super laser focused on how you help improve efficiency. So in many urban settings, you've got a lot of ED overcrowding and boarding. One of the ways you can solve that is to make sure you're discharging, you're doing care coordination and discharges in a timely way. And if you look at a care team, they're responsible for doing that. But if they have a patient who's having an urgent event elsewhere, they can't do that. So those are things that really allow for a virtual intervention to say, hey, we'll do the discharge virtually. We can loop in a family member. We can loop in the care planning team and do it all together and do it in a timely way.
So you also refer to this concept of virtual nurse sitting, I think.
Yeah, there's virtual safety, and
Yeah.
we use virtual nursing support, right? So safety is providing eyes on a patient so that they might have a risk for falls. They might have eating disorders. They might be behavioral health patient. There's violence concerns, and you'll monitor them for safety. And we do that with a combination of a human observer and leveraging artificial computer intelligence and computer vision to be able to look for things that might indicate something's going wrong. We just had an AONL presentation by Peterson where they decreased their alerts by almost 40% by using the computer vision to improve quality over what even a human on average is doing.
So
and then virtual nursing augments the virtual nursing teams to provide discrete tasks that, if done at the right time, can improve overall efficiency or safety.
Okay, I got it. That's so cool. So when you think about telemedicine as like an overall bucket, you're engaging with the health system and actually creating this hybrid where, from what I am understanding, I'm just trying to make sure I'm getting it correctly, the health system is going to leverage your tools and your insights and technology in a manner that supports their delivery of care inside the actual facility, but also can extend out to support care in remote, like ambulatory or even like home settings. Is that within scope?
Yeah, we've got, it's early days on hospital at home models, and those are areas that we're looking at. And the primary scope is across that health system enterprise, anywhere they're delivering care. And, we'll give you an example is you have specialty physician consults or specialty skills like wound care. You can bring those in virtually so that they can be leveraged across your network, right? When you're leveraging across the network, you can be more efficient in the use of those really scarce resources to make sure you can serve patients, which is best done closest to their community. And everybody benefits from that, right? The patient gets care in the time they need it, in the place they need it. The health system can make better use of their specialty skills and cut down on drive time. So that's an example of how you can do that. And that is now moving and extending into the home.
So what's the biggest impediment to AvaSure's next big leap that would make this standard of care everywhere?
As you bring in new technology, it kind of goes through a life cycle. And at first, it's just exciting. And there's a lot of piloting. So as we saw 24 and parts of 25 and early 23, there was a lot of piloting happening, but they weren't scaled. But what's happening during that piloting is you're also developing proof points and business cases and ROI, right? As we all know, health systems operate on low single-digit margins on average or negative. So to say, how do you invest in this? You've got to have a really clear adoption model and roadmap. And at AvaSure, we're over 10% clinicians, and that's deliberate. So we're a technology company, but we've got deep clinical expertise in sales and product management and customer success so that we really help our customers step back and say, what are the best practices? How do we adopt them in an order so that this program is paying for itself and delivering ROI. Almost 3/4 of our customers have ROI in less than 6 months, and that they can use that to pay for and roll out these types of technologies, that when they're rolled out, you have to roll them out on hard dollar ROIs, right? And those have to deliver value. But then you get all of these great soft dollar impacts, higher nursing retention, greater patient satisfaction. There's a lot of things where a patient actually would prefer a virtual intervention. And I'll give you an anecdotal example. If you're having a deep conversation with a patient in the hospital, we hear all the time where patients say things such as, I would have shared this with my nurse. They're fantastic, but they're so busy, right? So slowing that conversation down, being able to go deeper, better connecting with the patient, getting better insights and data adds a lot of value. But you're not going to put the program in on that, right? You need the hard dollar savings. And the impediment has sort of been the financing models. And what we're seeing now is enough of the ROI proof points and cases that this market is going from, if you look at, just under 1 million beds, so a limited number have adopted, potentially, less than 100,000 are sort of really done it. And now we're seeing tremendous acceleration. And that's being accelerated also by additional technologies in the room, being able to sort of use computer vision to look for violence, but also drive efficiency, bringing things like ambient documentation right to the point of care to make that room ambient so that you can walk in and hands-free say, hey, I'm going to start taking notes.
Right. You have a platform there basically that can bring together a lot of different services. And I assume you don't build all of the services, but if you can be the central platform, that would be more of a unifying tech strategy where people don't have to piecemeal all this. Is that fair?
Bradley, that is an awesome tee up, because something I think we do better than anyone else in the market for sure, amongst a few things, is because we have the largest base of over a couple hundred health systems and over 1,200 rooftops. We have said, hey, how can we bring the most value to customers? And the platform is open, and it's not just that it's open and you can figure out how to work with it. We've got a specific area in our business that goes out and creates an ecosystem around this. And as you look at smart hospitals and smart rooms, there are a number of things you want to integrate with. And we're going to integrate, there's a tremendous amount of innovation happening in computer vision, as an example. We're building our own models around safety and pressure ulcer reduction and patient flow, and doing that. But there's other models. We're partnering with a company that's doing computer vision vitals. Phenomenal. Imagine you can put eyes on and look for patient deterioration across your whole population. We are working with a number of the ambient dictation companies so that you can use that high quality audio in the room to make that available within the room. And then we integrate with some of the other core technologies like nurse call and making sure you've got the right information and signaling in the room. And we've got a deep partnership with Epic in terms of making sure things like Epic TV work well on the platform, and that you could be right within Epic and from a user not interrupt your workflow, but automatically launch a virtual engagement. So the openness is critically important. And the fact that that technology is really eyes and ears into the room, and that we can deliver it at scale, and that it becomes a portal for other technologies to engage with patients and the audio and video in the room.
Yeah, I could envision the AvaSure app store at some point where, hey, any service that makes sense as a connected offering, we've got a straightforward way for that to tie in. And obviously you want to be on the nice list with Judy and Epic over there. They've got a pretty strong position.
Absolutely correct.
Yeah.
But, and then like we announced something recently with Suki, right? They're early on in sort of this nursing documentation ambiently. That's 20 to 30% of a nurse's time. So as you start to think about like, how do we make step functions improvement so that clinical team members, nurses and other, can more efficiently and more effectively serve patients, right? So you bring some of the human touch back So bringing Suki and nursing documentation right to the point of care, has the potential to make a tremendous workforce productivity and improve the timeliness of the information that's entered into the medical record.
That's awesome. Well, it seems like the move you made to AvaSure was the right one. That's such an important area of the healthcare industry, and I think it's interesting how you've blended this use of these technologies with the actual human touch, because I do think there's an element of care where having an actual human engage with that individual and care and there's something there, right? Like even if we had robots that could do all of those things theoretically, and you had a God model from an AI perspective, I don't think you would get to the same outcome, because people somehow just have this electrical, connection and attraction to other people being part of care. And in our business, we're all about, in our portfolio, using advanced AI to identify signals that no human would have the time to go through and find them. And then we drive some sort of action that helps make it so the outcomes are better, which is similar in terms of just the high level description. And we also incorporate reinforcement learning through human feedback so that you have the best of the brains aligned with the tech and you make it get smarter. But then when it has to do with engaging the patient to, for example, ensure they have a certain diagnostic done or optimize their medications or use the best possible medical device, there's a human in that loop, who's conveying that information and engaging with the patient. And that's what I'm seeing here, is that you have this ability to intelligently put the humans in the loop. And when I think back to when my own mom was in the later stages of her battle with stage 4 cancer, she was in the Cleveland Clinic system, which is an amazing world-class health institution. The talent
Absolutely.
of clinicians was off the charts, but I saw an incredible amount of fatigue on the part of the clinicians who were trying to make the rounds and be at the right place at the right time. But it was basically like spreading the peanut butter like too thin, because they didn't really know like which one had the highest urgency. And the freaking alarm fatigue, right? Like constantly the alarms are going off and it doesn't mean anything 92% of the time. I think if what you're describing and what I'm seeing here had been a reality in that environment back then, the outcome may not have changed, because unfortunately she had very advanced stage 4 cancer when she got diagnosed. But I think the experience could have changed dramatically, where you would know when to be there, at the bedside to be supporting her care, when otherwise you just couldn't have eyes everywhere, right? So this gives you sort of the eyes everywhere.
Yeah, I think it's critical that these technologies really allow humans to be back in front of patients and care for them, right?
Yeah.
And too often, especially in health systems, and unfortunately in your mother's case, you're asking humans to be documenters. You're asking them to go be integrators of information that should be made available at the right time for the right user.
Right.
You're not giving them the right support because you've maybe taken away some of their support resources to do other things. And, ultimately, if you can, bring the human more back into the loop, bring our care teams that are super passionate about and went into their roles to make a difference in patients' lives, that just has tremendous benefits, right? And it sounds, I don't mean to be Pollyanna here, but like you got to bring the joy back into care, right? Even though these are tough experiences, when we're asking so much of our care teams, and we saw this coming out of COVID, people started reaching a breaking point. So
Right.
automating things that can be automated and integrating things and bringing the right information to the right place. And I know that sounds crazy, but when you walk into a room and it's monitoring for safety, so you don't have to worry about that, because nurses too often are being fearful for their safety in some environments, and that there's a cocoon of safety there, that your patients, if you're not with your patient, there's eyes on them, right? They're okay. And then when you walk into the room and you need to document, it's happening more automatically, or The information you need can be available right there on the whiteboard in the room for you to share with your patient. Or you need a second dual set of eyes for a narcotic, and you don't have to go take someone away from another patient. You just bring in a nurse virtually so you can both engage. Those are the things that are really moving the needle. So it's an exciting time.
Well, I'd say I see a lot of things, and everybody's talking about AI use cases. Most of the AI examples that I'm seeing that are in production in live environments are very operational and administrative and efficiency oriented, which is super important. It seems like you're covering a lot of that ground and also including some real clinical benefit that is being done in a way that makes a lot of sense, that really doesn't have a lot of the gaps that other clinical use cases can have, where we're not quite there, where we're ready for AI to go too far with respect to what's happening with patient care. So I certainly commend you guys for what you've built. And before we wrap, though, I have to switch gears for a second. We opened up talking about sports, which is something that is a great teacher for all of us, including those of us that are in healthcare and realize that you have to persevere. And when it's, 4th and 1 and you're just completely exhausted and you have to figure out, like, can I actually get it into the end zone? There's this, as you called it, the 6th gear earlier. So you have to share if you're open to it. I can't stop talking these days about the fact that I played football for Indiana, which was something I never admitted years ago, right? 16-0, but you were talking about a lacrosse game and some success maybe one of your kids was having or something. What's your sports? What are you following and what are you excited about in the sports world?
Well, it's hockey playoffs, and I'm originally Canadian. So if I say out
I
about
heard
our
that
house,
in the accent, by the
you
way.
get,
I grew
you
up in
get a
South
little bit of
Dakota.
that, and
Canadian.
I live in Carolina, and they won in double overtime last night. So,
Okay.
it's
They won. Hey, awesome.
they won. So I follow that, and I've had some children play some lacrosse. So I've been to a lot of games, and sports isn't the only way you can learn some lessons. It is one way you can learn some lessons, but you got to be gritty. You have to really work well with teams and commit to something that's bigger than yourself. And you have to be coachable and just continually be learning. And those are, whether you get those experiences through sports or otherwise, it's a great place to do it. And, also putting some pressure injected as you get into game, and being able to do that under pressure that's what we need in life, right? There's a lot of things that come at you hard and fast. And you got to remember why you're there, what your training is, and how to execute. And you got to remember how to lift up team members around you and feed off of the energy from them and bring energy back to them. And so it's been a good experience. I learned a lot through sports, and they're also it's why they get the big ad dollars. They're it's the unpredictable nature of what's going to happen next, and it's exciting.
AI is not going to eliminate live sports, I'm positive. So it is a lot of fun. I think the leadership skills that we need in healthcare, I think a lot of those are exemplified in some of these sports situations. A couple of years ago, I have a really good friend who's in New York, and he has some great tickets to Knicks games and Rangers games. And a couple of years ago, I had the opportunity to go to a courtside Knicks Pacers playoff game in the Garden. And then the next night we went to a Rangers playoff game, which they won in overtime. And I didn't really grow up with hockey, but I became a big fan after being in this overtime environment. Those fans and the energy in that place.
Live hockey is exciting. And,
oh my gosh.
Our chief growth officer, Warmis Hardy, is a Rangers fan. So
awesome.
It's good stuff.
I became a Rangers fan. So, well, hey, Adam, it is such a pleasure talking to you, learning more about your background and what you're building here at AvaSure. You're clearly one of the examples of the kind of innovation that we need more of. And I look forward to continuing to compare notes. I think that we have a lot to talk about as a follow-on here.
Great. Hey, broadly appreciated the time. Thanks.
Absolutely. Well, hey, everybody, thank you for joining us for another episode of Boombostic Health. We'll look forward to seeing you next week. Have a great day.